Hey everyone, Dr. Gage here, bringing you a video today regarding a common injury we see as chiropractors here. This injury typically surrounds a motor vehicle accident or a traumatic event, and that is whiplash, or what we call a hyperflexion or extension-based injury. So that typically occurs with motor vehicle accidents, like we said. It's an estimated that 83% of people who are in a motor vehicle accident will end up with a whiplash-based injury, and up to 50% of those people will still be experiencing symptoms 1 year after that event occurring. So this is a really, really serious condition that we want to make sure we're getting the proper medical treatment for. Here at HealthFit, we do a variety of different treatments, modalities, rehab exercise, a lot to help bring a well-rounded approach to the treatment of this condition. You can see those exercises, those modalities here in the second half of this video. But first I want to explain what's occurring a little bit with this condition. So as we talked about, it's typically surrounding a motor vehicle accident or some sort of traumatic event where hyperflexion, so of our cervical spine here, we go into flexion here and hyperextension there. So as you can imagine, getting into that motor vehicle accident, a rear end, a fender bender, something like that, where the head snaps forward and back super fast can cause this sort of injury. First thing we want to make sure here is that there's nothing serious, no red flags with this injury, as we would say. So we want to make sure, rule out things like fracture, any sort of cervical instability in the cervical spine here. And then it becomes a soft tissue component that's typically involved here. So with this hyperflexion and extension that occurs rapidly, we often see a lot of the neck musculature go into spasm here. This is what can be a huge component of the treatment plan, is getting those neck flexors and the extensors to just relax. They don't need to stay spasmed, but that injury occurs because instability is felt, and then those muscles tighten up and they lock up to make sure that the cervical spine is stabilized. So as you can see here on our cervical spine model, the cervical spine here is in purple. We've talked about in previous videos on our Instagram page, cervicogenic or tension-based headaches. A lot of those stem from these muscles in the top of the cervical spine that attach to the top of the skull here. You can also see some of our scalene muscles that attach from the cervical spine, and those are the muscles that come down the side of the neck. Those can be a component of this. And then of course we want to talk about joint motion as well. So joint motion of the cervical spine, assuming that there's no instability and no contraindications for joint manipulation, that's something we want to get back to and restore there, as well as in the thoracic spine here, especially the upper thoracic spine. So this area here, all the way from the occiput down to about T4 here, is somewhere that, T4, T5, somewhere that we want to make sure we're addressing all joint motion throughout that region. That's that cervicothoracic junction that can be a huge component into the treatment plan there. Like I said, we'd like to discuss and make sure that we're doing a well-rounded approach here with our patients. Each case is going to be different here, so some cases might be more soft tissue related, some might be more joint motion related, and we utilize things like our shockwave therapy. We have a specialized tip that we can utilize on these suboccipital muscles here. There'll be a video of that later on here, as well as a lot of soft tissue work with the active release technique, and then rehab exercise to just help calm down that area, bring down inflammation, help the muscles relax there, and then make sure we work on stability components to make sure that this is not something that's going to flare up again in the future. So in the next part of the video here, you'll see some of the clips of exercises and the modalities that we like to utilize here at HealthFit. Feel free to shoot us a DM or reach out to us if you have any questions regarding this. We look forward to seeing you in the future. Take care.
All right, so as you guys can see here, we're working on some chin retractions. This is a great starting exercise after a hyperflexion or extension injury. Then we go into stretching some of the side neck muscles there with a levator stretch. And then here you can see we're implementing shockwave therapy with chin retractions to really bring down that pain and inflammation.